Hello and welcome to our webinar, Central Auditory Processing, What Age Should We Test? If you're listening to this live webinar on May 10th, 2017, and wish to earn an ASHA credit CEUs for this course, you must attend the entire 1-hour session. The handout and all forms you need to complete. Okay, there's the form. Or the slide. All the forms that you need to complete to obtain your CE credit were mailed to you in the reminder email, and they can also be downloaded from www.speechandlanguage.com. You will need to mail the ASHA participant form and the evaluation form to the address shown at the bottom of this slide. The forms must be postmarked by May 22nd, 2017. If there is more than one person at your location, you'll need to download the attendance sheet and have each person requesting CEUs sign the sheet and complete the ASHA participation form and the evaluation form. No CEUs are offered for viewing the recording of this session available on our website. Now I am pleased to introduce our featured speaker, Dr. Donna Geffner.
Hi there. Good afternoon to those of you, and good morning. I'm delighted to be here. And my topic today is Central Auditory Processing. What age should we test? And I'm very much aware that it has become a topic of discussion among many of us who do central auditory testing in youngsters. But first, let me begin with a disclosure. I'm going to be talking about the Auditory Skills Assessment, of which I am one of the authors, along with the late Ron Goldman. And as an author, I do receive royalty from Pearson Assessment for the sale. There are no other non-financial relationships to disclose. All right, our learning outcomes for today. That is, I would like you all to be able to identify various behaviors that we see associated with auditory processing disorders in young children, to be able to know a bit about the various tests and instruments available that address younger children, and to be able to apply the Auditory Skills Assessment, known as the ASA, to identify and manage and treat some very young children who could be at risk for having an auditory processing disorder. Agenda. I'm going to talk about the history of testing in young children through the years, talk about the symptoms that we see in these youngsters. I'll give an overview of the various instruments that are available, and I will talk about the ASA and provide case studies of individual youngsters who have taken that test and what results occurred. So the purpose is for me to provide a rationale for early testing so that we can identify youngsters at risk. It often occurs to me, or I hear from parents calling and saying, I'd like to have my child evaluated, but the school tells me I have to wait to the age of 7 or 8, so I can't have the child tested, but I know that my 5-year-old or my 6-year-old has these symptoms. I know they're having trouble understanding. They're asking what. I have to repeat. They don't mimic speech properly. Their own speech is affected. They have trouble following directions. Now, that could be a myriad of things. It could be poor receptive language. It could be poor attention. But it could be poor auditory processing skills. And so my purpose today is to at least enlighten those of you who are participating to think about testing children younger and not waiting and missing out on those critical early neuroplastic years. So let's talk about the history of testing and what are the symptoms. The big question has been, how young can we test children for linguistic and non-linguistic auditory skills? Well, what has been done? And in my research, I found that there's been a number of different studies all around the universe. Children as young as 3 years of age have been found to be aware of onsets and rhymes and develop a strong relationship between the knowledge of nursery rhymes and the development of intrasyllabic awareness skills. And that was back in 1987 by McLean et al. And then phoneme isolation and segmentation produced a very good predictive validity for later reading skills, as found by Lieberman and Schenkweiler back in 1985 and Yap in 1988. Children's ability between the ages of 4 and 6 to discriminate between stimuli that vary along single acoustic dimensions is much poorer than adults. Well, we figured that to be the case. But we also found in some of the studies by Jensen and Neff that intensity discrimination became adult-like by age 5, and frequency and duration improved with age. Of course, the skills are poorer than adults' discrimination for many 6-year-olds, but nevertheless, the skill has been developing. And sometimes general musical skill development, as we see in youngsters, are often affected as well. So many of these very young children have trouble following a tune. The ability of normal hearing children between the ages of 4 and 7 on an auditory discrimination test was found to improve with increasing age until about the age of 7, when the skill became adult-like. According to Allen and Nels in 1996, 7-year-olds and adults were able to discriminate the sequence of tonal pairs with component frequencies. And as the sequences were increased, the 4 and 6-year-olds as a group couldn't perform the task because obviously it became more difficult for them to do. So Torgerson and Mathis, who's done a lot of work in the area of reading, found that children can detect and compose rhymes by kindergarten. And at the end of kindergarten, they can isolate and pronounce the beginning sounds in a word. And midway first grade, they can isolate and pronounce all the sounds in 2 and 3 phoneme words. So the phonemic awareness skills are developing very early on. By the end of the first grade, according to Torgerson and Mathis, children can isolate and pronounce the sounds in 4 phoneme words containing initial blends. Some children may acquire some rudimentary phonological awareness skills as early as 2.5 to 3 years of age, and then the more advanced skills are not mastered until the end of the first grade. But we do see an emergence as early as 2.5 to 3.5. Now, according to Burt, Holm, and Dodd, 1999 from the UK, these are the skills that preschoolers should be able to have: produce consistent phonological representations, imitate non-words, produce lexical items, an imitation, naming, and connected speech, segment words into syllables, demonstrate awareness of rhyme, and demonstrate awareness of onset. What is interesting also is that the children from upper SES categories do better, and so do older children. Burt, Holm, and Dodd found also that early identification of children with poor phonological awareness would allow appropriate intervention to be offered. An intervention, according to them, could prevent reading and spelling failure and the negative consequences that are associated with that. So we talk about many of these children are at risk for reading problems, and then the question comes down, well, how could we identify them earlier so that they don't have full-blown dyslexia or reading disability when they're third graders? So auditory discrimination skills, according to Krause et al., can be developed by age 6. In studies using the just noticeable differences, J&D, and mismatched responses for synthetic syllables, the different formats, they found that this does not require behavioral response or attention. And many aspects of auditory perception of non-speech and speech stimuli are largely mature by school age. And again, the perception continues during school age years, which can be modified by auditory experience. We know that the auditory system continues to maturate until about the age of 12 to 14, around the puberty period of time. So the auditory system does go through maturational stages. Children who presented, according to Boats et al., who presented with significant preschool deficits in phonological awareness, rapid automatic naming, speech and noise perception, and frequency modulation detection, were those who had increased family risk and literacy impairment by the end of first grade. So here's a real high sign, a red flag, to tell us which child should be in the queue for being examined, looked at, followed, because they're at risk. All right, let's talk about some of the other work later on by Carr and Nicole et al. And Krause's work, predicting reading skills in young children. Through the use of brain scans and CABR, that's complex ABR, using speech stimuli, It is possible to predict the 3- and 4-year-old children at risk for a reading disability on the basis of their ability to separate speech sounds from noise. In other words, that children who had trouble recognizing a syllable like la in the background of noise were those children who had difficulty with reading problems later on. Children who are unable to listen in a background of noise, as Nina Kraus says, the din of the classroom, are at risk for learning to read. And those that are able to block out the background noise and be able to detect that da were not at risk for a reading disorder. Thus, auditory processing in noise is a biomarker for literacy. And I think that's quite remarkable. This is a study in 2015 that gives us a real hint at saying, well, you know, we can start looking at very, very young children. So what happens in the special populations? What happens to these children who have reading disabilities? Children with reading impairment show subtle speech perception deficits in quiet, but very significant deficits in background noise. This is a study by Ziegler et al. In 2005. Children with a learning disability perform more poorly and are more adversely affected by degrading signal-to-noise ratio in speech and noise tasks, the work of Shermack et al. In 2003. Children between the ages of 2 and 4 with a receptive language problem showed poor performance on a nonsense word repetition task, Roy and Chiat in 2004, showing that poor performance on a nonsense word repetition task may be indicative of a wider language problem, at least in young children.